Hi everyone, Dr. Poe Raval. Welcome to Doc Dynasty, a channel completely committed to physician independence. And today I want to talk about an item in the news. How much responsibility do insurance companies have for patients' well-being? So let's talk about the tragic shooting of Brian Thompson, the CEO of United, Luigi Mangione, who has become the poster child now for insurance denial and patient pain, and what responsibility insurance companies have. I found a very interesting article in the New York Times this last weekend. It is labeled "Why I Quit My Job as a Health Insurance Executive," and it was written by Wendell Potter, who happened to be the head of corporate communications for Cigna. Soon after he joined Cigna, a company came in to Cigna and labeled this new movement as consumerism, which means that up to that point, patients had low deductibles and low copays. And the idea of this company was, if we increase deductibles and we increase copays, then we will not have to pay out as many claims. And this is the Kool-Aid that insurance companies have asked executives and people working for insurance companies to follow ever since. So this has gone on, as we all know, for quite a while. And what Wendell Potter notices is that, as expected, those that were doing well, had the money, had resources, paid higher deductibles and paid their copays in order to get superior care. And the people left behind were those that had chronic pain, where insurance companies were denying them the care that they needed, or those that did not have the resources to pay these extra fees. He makes a point of seeing lines at a clinic in Virginia where doctors were put into animal stalls, his words, and patients were lined up for 3 hours or more to get the most basic care. And more and more of this was happening, on top of denying claims outright. The first, whether you know any of the details of a case or not, care was being denied. We have all been subject as patients to this. We've all been subject as doctors to this, and how frustrating that is. So what made him quit? It turns out that eventually what happened was there was one patient, a 17-year-old leukemia patient, that was scheduled for life saving surgery, and literally almost on the operating table, Cigna called and said to the physicians, the surgeons, that they would not pay for his care. And so therefore this patient died. And it was too much. So this was the kind of the last straw that took him out. But the issues he brings up, we have all been subject to. And I think it's time that we have that conversation. Feel free to comment, look at the links that we have. Let's start that conversation, not just complaining, but let's talk about what duties the insurance companies have for their patients and for the doctors that are treating them. I think that's the conversation to have. Hope all can contribute. Stay connected, and please subscribe.